Hello, I'm Dr. Amalia Anghel. I'm a dermatologist from Bucharest, Romania. And today we are here with my patient Catalina. She's 32 years old and her main concern is skin quality and skin tone, just because she's having some pigmentation on her face, and she's very interested in having a very beautiful skin with an uniform tone. But Catalina can tell us what is her main interest.
My main interest today is that I have lost a little bit of the glow on the face, and for this melasma or hyperpigmentation that I have on my cheeks, I would like to help me today with those problems.
So she's focused on her skin quality. That's why I've chosen today the best product for her concern, which is Juvéderm SKINVIVE, the only FDA approved product for skin quality. And this is the best product for you just because you have one single injection with the indication for re-injection after 9 months. We choose together the best treatment for her face, which is Juvéderm SKINVIVE. And we choose it just because it is the only FDA approved product for skin quality, and it's helping us for the hydration of the skin, for her texture and the tonus of the skin. Also, you'll have a firmity effect, improving and having more collagen and elastin inside your skin. This is one single injection with a minimum recovery time, and the re-injection period is once at 9 months. So you will have your natural looking with a glowing effect, and you will have a more younger skin.
Perfect. I wanted to ask you, because I don't want volume on my face. I want the results to be very natural, yeah, without adding any volume to my face.
Mm-hmm.
Yeah. I think, is this the best product for me?
Yes, definitely is the best product. I know that the concern is when you hear hyaluronic acid, you say that it's a filling and volume effect, but Juvéderm SKINVIVE is not a volumizing product. It's addressing just the skin quality, hydration, and firmity of the skin. So we will not have volume at all.
That sounds great.
Exactly. Be very confident for this.
What about the pores on the skin?
Yes, we will improve the skin texture, and also we will diminish the dimension of the pores. So your overall skin, it will be smoother, hydrated, and with more firm.
What will be the recovery time after this treatment?
The recovery, it will be minimum. The treatment is an easy one, so you will feel just a bit of pain. And the worst case it will happen, it will be that you can have some small bruising, but it is not mandatory. So at the end we will discuss about what to do, what you don't have to do at the end of the treatment, but you don't have recovery time, and it is a very easy treatment.
Can I go to work tomorrow?
Yes, definitely. You can go to work and your skin looks normal, perfectly normal, so nothing very important to manage.
Okay, great.
In order to have a complete covering of the cheek, we can have some markings with vertical lines and some horizontal lines. Inside them, we will inject an uniform amount of the product for the complete spreadness and an uniform effect. So we draw some lines. The first vertical line is from mid-pupillary line. The second is lateral canthus, lateral orbital, and the lateral cheek divided in two. Those are 5 vertical lines with horizontal lines. The first one is with the orbital rim. The second one goes from the alveoli of the nose to the tragus. The third one is mid-nasolabial fold. The fourth one is the oral commissure to the mandible angle. And the last one is 1.5 centimeters below. So we have 20 boxes to fill with. the product in a uniform manner with an amount of the product around 0.05 ml, covering the full cheek with 1 ml of Juvéderm SKINVIVE. We can also mark the forehead starting from the center. The second one, it comes to the mid-brow. The third, mid-pupillary line. Lateral canthus and the lateral orbital. Here we will describe the horizontal, the same on the other side. The first line, it is 1 centimeter above the eyebrow, with 2 more horizontal lines, and we fill each of these boxes with approximately the same amount of product, which can be with a smaller amount comparing with the cheeks, around 0.2, 0.25. We need to be very careful just because here the vessels are superficial and we can meet them in the dermal layers. The danger zone here, it is the glabellar line and area, just because we have the vessels inside the subcutaneous layers and we need to be very careful. This is not an injection point for hyaluronic acid, how we know. We start injecting and we start from the lateral part, stretching the skin with a needle in 45 degrees in order to stay in the dermal layers. If our needle will be parallel to the skin, we will be superficial, neither perpendicular, because we can inject in the subdermal layers and we want to sit in the dermal plane. So we will inject uniform all the surface of the cheek, how we see, filling the boxes with 0.05 ml of the product. We will inject in vertical lines or horizontal lines with the proper amount of the product in each box for diffusing and merging the full skin for the best result, injecting in the dermal layers and with uniform spreading over the cheek. Every half of the syringe will change the needle for a more precise treatment, and it will be a bit less painful just because we have very thin needle. So we will change it every 0.5. For me, the most important area, we treat full cheek in order to have the spreading of the product and to have the hydration, the firmity. But the most important area for the texture and pores, it is a central cheek, because here we have the large pores that she was interested in. So 1 ml for every cheek. Cleaning and disinfecting of the skin is very important. We do the cleaning before, during the treatment, and mandatory after the treatment. Treating the neck, we address the full neck area, so we need to have a good quality of the skin with firmity, but also we can improve the lines, the horizontal lines from the neck. It's not our patient case. She's having very delicate lines. That's why we will inject the full area of the neck for texture, hydration, and a bit of firmity. I choose Juvéderm SKINVIVE for the neck area because I want to address the quality of the skin, the hydration in this area, firmity, and also the fine lines. Juvéderm SKINVIVE, it will improve all the aspects of the skin. The neck area it has a very thin skin, so we need to be very careful while injecting Juvéderm SKINVIVE. We need to stay in the dermal layers, but also should be careful for the visible papules not to appear. This is a risky injection side effects for the area. So we inject the uniform in this area by addressing vertical, horizontal, but we need to stay in 45 degrees. Be careful for the vessels also. This is the proper papule that it can be visible due to the amount of the product that I place in the skin. But when I apply the pressure, it will spread uniform in this area. This is a proper visible injection mark, placing the product in its specific layer, like dermal layer ideally. But when I apply the pressure, the product, it will spread and will have an uniform surface of the skin. No visible papules, which is let's say, the unpleasant reaction that it can happen in this area due to our thin skin. A very good cleaning of the skin. Before starting the treatment, we inject starting from the lateral side by stretching the skin. Micro droplets 0.05 Juvéderm SKINVIVE. About 1 centimeter apart. At the end, we clean with a disinfecting solution, and we can also make the massage with this. If we inject in the proper place, we don't need to have a stronger or a longer massage. The hyaluronic acid, it is spreading through all the area uniform. We can have a gentle massage for the neck in order to have the spreading of the product. It will be very gentle and the papules will disappear. They are not really papules, it's just the substance in between the layers of the skin that it is visible until we have a very soft pressure. But here is the area that we need to be very careful in order to inject in the dermis for the maximum result of the product. We need to be careful for the thickness of the skin. Otherwise, we can have these visible papules and they can be a problem over time. But if we inject properly, we are careful and with the eyes on the skin, nothing will happen. We completed the treatment. They were 20 minutes maximum of injection. How we can see, the face is just a bit red. We don't have any major effects on the face, just small bleeding points that have gone away. No bruising, no nothing. So our patient is perfect at the end of injection. She just need to be careful with the face today. Good and very good washing, no makeup for the face. She can apply a repairing cream with an SPF. And today, please avoid all the activities that can induce redness on the face, like hot sauna, hot bath, or exercise. Apart from this, we have minimum recovery, how we can see, and the indications post-treatment, they are not very difficult to follow. This is a very easy treatment to be performed with an amazing result over the next 9 months. For Juvéderm SKINVIVE, we expect the effect after 2 to 3 weeks, and the maximum it will be after 4 to 6 weeks, maintain up to 9 months, when is the re-injection time. I personally recommend Juvéderm SKINVIVE for every patient. Even if you are young and you want to take care of your skin for prevention, or also for the mature skin, we need to have a healthy skin, of course, with some other aesthetic treatments. So everyone, every skin type, no matter the age, they can benefit from this kind of treatment. From my experience with a similar product over more than 10 years, I have the most recurrent treatment, it is this. Just because the injection, it is one single shot with an amazing result, and this is a treatment that can be made over the full year. Of course, we can prepare the skin for the summer, like being hydrated and ready for the exposure, but also we will inject this Juvéderm SKINVIVE no matter the month. We can inject it to prepare it for an event, to prepare it for the holidays. So every month of the year it can be a period for the treatment. So this is the only FDA approved product for hydration, healthy skin, and we can improve in this way the texture, the pores, the glowing of the skin, the tonus of the skin, the firmity by its mechanism of action, which interfere the aquaporin channels for the hydrating natural mechanism of the skin, and also is activating the fibroblast, the skin cell that it is responsible for the collagen and elastin. In the last years in the aesthetic medicine field, I noticed changing from our patients' side. So they went more from the transformative treatments with volumizing protocols to more natural and more authentic treatments. They want to be themselves. So they main focus changed on the skin quality and the aspect of the skin. Their main concern is the appearance of the skin, the glowing of the skin. So that's why we have now an amazing tool, which is Juvéderm SKINVIVE. I think that it will be a game changer for the aesthetic medicine field, just because we can help this patient to achieve a more younger, natural, and more glowing skin. This is a very good product that we can use to fill their needs, to complete their needs. And we are not talking just about the face, we are talking about the neck, about the décolleté, and also the hands. All of these are very important areas to be treated, and Juvéderm SKINVIVE, it is the best product to use. With all the advantage of the treatment, it is easy to inject, very good result. We have studies to support this affirmation, and we have one single injection 9 months apart. This treatment is not about changing who you are, it's about building confidence in your skin every single day. Thank you for watching.